Good afternoon, ma'am. My name is Jonathan Musanto Abin, and today I'll be performing the IV or the intravenous infusion, regulation, and monitoring. So as you can see, I have here my equipments. For first one, I have the IV set. So the IV set, I already checked the integrity of the IV set, and there are no holes in it, and it's already completely fine. And for the second one, I have the IV solution with the label card on it. So you can see there is the name of the patient and the solution. It's 1 liter times 10. So yeah, um, and I've already washed my hands and did a proper procedure of infection control. Okay, so let's get started. Good afternoon, sir.
Good afternoon.
My name is Jonathan Musanto Abin. I'm a student nurse of AUP. Today, I'll be doing the intravenous or IV infusion, regulation, and monitoring. And with that, I already checked the doctor's orders. Do you feel comfortable, sir?
Yes,
Okay, may I know your name, sir?
Johannes Kurniawan.
Oh, Yanis Konyawan. Okay. So, good to see you, sir. So, how do you feel? Do you feel comfortable and do you feel fine as well? Okay. So, I'll be performing the IV, and to reassure you, this will be safe and it will be kept confidential. I already washed my hands and I already provide privacy. Okay, so let's get started. So first thing, what you're gonna do is you're gonna open the IV set. Open the IV set. Once you open the IV set, it's in the trash can. Okay, once you open the IV set, make sure that there is the cover of the spike and the cover of the inlet and the presence of inlet as well. So you just gotta make this, gotta put this roller clamp up. Okay, so once everything is done, just place it in here and get the IV solution. Once you have the IV solution, open the cover of the IV solution. Okay, once it's open, place it here. Once it is open, you may get the IV line. Okay, get the IV line. Okay, and remove the cover of the spike. And make sure to be cautious to maintain the sterility of the IV line and the spike. Okay, once it is good, make sure to insert the spike to the IV solution. Just poking it inside, twisting it. Okay, wait. Okay. Once it is inserted, okay, make sure to close the roller clamp. Okay. Okay. Once it is inserted, place the IV solution together with the IV line to the IV pole. Okay. And next up, what you wanna do? Okay, let me just. Next up, what you wanna do? You want to squeeze the drip chamber up to half. Okay. Once it is already in half, we will do the priming. So the goal for the priming is to let the airway flow through the line in order for the solution to come out through the inlet. And when doing that, make sure that the cover of the inlet is closed and it's already good to go. Okay, so we'll do the priming. Okay, so make sure that you place a basin in here so that to let the solution flow through the inlet. Okay. You just do it slowly. Do gently, be patient until the solution comes out through the line. Okay. 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 Once it's already the solution goes through the inlet. Just close this. Once the solution goes through the inlet, um, it is already ready to insert to the patient. So you're just assuming that we already removed the cover and we insert this to the patient. Okay. Okay. Just excuse me, sir. I'll just insert this. So just assume that it is inserted. Okay. Okay. Just use tape. Okay. So assume that's already inserted. Okay. Okay. Just stay still. Okay. Now, I'll be doing the regulation. Okay, what you gotta do is you need a watch, and as you can see in here, um, it says it is in 1 liter times 10. So 1 liter in 10 hours. And just to make sure before you perform this, you have already do the calculation, and I've got it into 33 to about to 33 drops per minute, okay, or maybe 32 to 33 drops per minute. And here, yeah, we just convert it to milliliters, and yeah. So I'm gonna get the use the roll clamp to count all the drips in per minute, okay. Okay. Once everything is done, um, you may ask the patient's comfortable. Okay. So I've already inserted the IV infusion. Do you feel comfortable, sir?
Yes.
Oh, okay. So if you have any response or anything or anyone you want to ask, you may come to us. Okay. Feel free to come to us. Um, and now I'll bring this to the nursing station, and I'll be recommending the transpire process. Okay. Thank you, sir, for the participation and cooperation. Thank you. Good afternoon, ma'am. My name is Jonathan Monsanto Abin, and I'm from Section A. Today I'll be performing the discontinuing IV infusion, and I have here with me my equipments. As you can see, I have my gloves, my scissors, my tape, the wet and dry cotton balls. And I already washed my hands or did a proper hand hygiene, and as well as I've already had my proper procedure of infection control. Okay, so let's get into it. Good afternoon, sir.
Good afternoon.
My name is Jonathan Mosanto Albin, and I'm a student nurse of AUP. And you are Mr. Cornelian, am
Yes.
I right? Okay. See. Today, I'll be discontinuing the IV infusion, and what just had the doctor said that you have already consumed your doctor's medication, and it's already good to discontinue the infusion. Okay. Do you feel comfortable, sir?
Yes.
Okay, that's good. And to reassure you that this action or this procedure will be kept confidential and safe, okay? And I already provide privacy and already had my hand hygiene as well, okay? Okay, so let's get started. Okay, before we do anything else, we have to close the roller clamp completely, okay? Before we start, and the part of the assess, we need to assess the insertion site if there are any complication or implementations as well. Okay, excuse me, sir.
Yes.
Okay, if it's all good, and then we're good to go. Okay, what we need first is we need to wear our gloves for safety. Okay, let's wear the gloves. Okay, once we already wear our gloves, it's time to us to remove infusion. So what we need to do is we need to moisten um, the stabilizations inside. So get the wet cotton ball, wet the tape in the stabilization site. Okay. Once done, just remove it. Just remove it gently. Okay. Especially if you have a patient who has who's really hairy. Okay. Okay. Next up, what you want to do is you get the wet cotton balls again, and we uh, moisten the tape in the insertion site. Okay. once we've done that, push it here. Once we've done that, we just pull the tape. Just do it slowly. Okay. Do it gently. You don't have to bring everything completely. Just bring them into the insertion site. Okay. 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 Once it is done, get the dry cotton ball. Okay. Once we have the dry cotton ball, just place it just near above the insertion site. Once you have there, pull the IV line gently, okay? Pull it, carve it in the insertion site. Okay. Once it's done, don't forget to place the IV line in the IV pole. Okay. Okay. Once it is done, you don't have to press this too strong, just lightly, and get the tape. So get the tape, place the tape and the insertion site. Okay. Okay. Once it is done, just do a pressure in the insertion site. Do a pressure up to 2 to 3 minutes until it stops bleeding. Okay. Okay. Once it is done, uh, we may document the process. Okay, sir. I have successfully discontinued the IV infusion, and it's already good to go. And do you feel comfortable when
Yes.
I did the process? Okay, that's good. That's good to hear. And if you have any response, you may feel free to come up to us and ask or respond anything regarding this the procedure or anything. Okay. Okay. Now I'll be uh, returning these equipments to the nursing station, and with that, I'll be washing my hands as well. Thank you, sir, for your cooperation for today, and I'll get going. Okay. Thank you. God bless. Good afternoon, ma'am. My name is Jonathan Mosanto Abid, and once again, I'm from Section A. Today, I'll be performing the starting and IV infusion through volumetric chamber. And I have here with me my equipments, and some of them are also improvised as well. And as you can see here, I have my labeled card, my morphor, together with the scissors and the cotton balls inside as well. And in my right side, as you can see, there are two IV solutions that I will be using to improvise them. So as you can see here, this will be my volumetric chamber equipment. And I'll be separating them. I'll be separating the IV line that will connect to the volumetric chamber, and as well as the IV line that will connect through the patient. But we'll just be assuming that this will be the volumetric chamber equipment. Okay. Yeah, and we will walk through that later. And I already performed hand hygiene and did a proper procedure of infection control. Okay, so let's get started. Good afternoon, sir.
Good afternoon.
Let me introduce myself. My name is Jonathan Musanto Abin. I'm a student nurse of AUP. May I know your name, sir?
Yohanes Kurniawan.
Okay, good to see you, Mr. Kurniawan. And right at this moment, I will be performing the starting an IV infusion through volumetric chamber. And with that, I'll be touching your skin. That will be the part or process of the assessment, okay? And um, to reassure you that this action or this procedure will be kept confidential. And I already provide privacy and did hand hygiene, okay? Okay, so let's get our, so let's start, okay? Okay, what we normally do, we just, for the priming, we normally do just use the roller clamp and uh, and start to let the solution uh, walk through the drip chamber. Okay. So with this improvised, so let me hook this up. Okay. So this will be the IV line, IV line that will go through the volumetric chamber, and this will be the IV line that will go through the patient. The patient. Wait a second. Okay. 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 Before we get going, before we proceed, we need to close the roller clamp. As you can see, it's closed. Okay. Okay. Now, in doing the priming, what when I will be doing here, I'll be performing. So I'll be just let the solution fall through and go through uh, the volumetric chamber. That the IV solution must reach up to the range of 20 to 30 ml. Okay, so wait. Okay, wait. So okay, as you can see the solution. So we will just wait until it reaches the range of the 20 to 30 ml. Okay, once it is done, first just goes the roller clamp. Okay. So we just assume that this will be the volumetric chamber, and as we normally observe, um, the bottom part of the volumetric chamber must be the connection of IV line that will go through the client, but we just assume it that it is connected. Okay, and yeah, so this will be the volumetric uh, uh, volumetric chamber. Sorry with that. Okay, just place it here. Okay, now we will walk through the priming through the IV line that will be connected through to the patient. It will be inserted to the patient. Okay. So first we just squeeze the drip chamber into half. Okay. Once we've done that, we'll be using the roll clamp. Just what sir has just demonstrated in the video in the MS Teams, we should be placing the roller clamps just near to the drip chamber, even if it's in the above or in the bottom. Okay, but this is, we just assume that this is already close to the drip chamber. Okay, so we will do the priming of the IV line that will be connected to the patient. Okay, so let's get started. So this will then, to remember, don't remove the cover of the inlet, okay, when we do the priming. Okay, we do priming just to make sure that the airway will go through the line and the IV and the solution will come out. Just just prepare a basin that is for the IV solution to come out. Okay, once it is done, you must close the roll clamp. Once it is done, it is already prepared to be inserted to the patient. Okay, so okay. Excuse me, sir.
Yes.
Now I'll be inserting this for you. Okay, just stay easy. Okay. Okay, just stay still. Okay, let's just assume that it's already inserted. The IV line is already inserted to the patient. Okay, yeah, and after that we just ask the client's response. Okay, sir. Now I've just inserted the IV line for you, um, and it works successfully. Do you feel comfortable, sir?
Yes.
Okay, that's good. And yeah, and for today, if you have any response, you may feel free to come up to us or other medical staffs. Okay. Okay, sir. Thank you for the participation and cooperation. Now I'll be get going, and I'll set everything up, and we'll be um, collecting and giving it to the nursing station. Okay, and I'll be washing my hands as well. Okay, thank you, sir. God bless.